Good afternoon, everyone, and welcome to The Rent Eats First, how housing can negatively impact community nutrition. My name is Yolanda Gordon, and I am the Manager of Expansion and Advocacy at Results, and I'm responsible for the Results Fellowship, which is a leadership program for young adults 20 to 35. And now I'm going to pass it to my colleague, Michael.
Thanks, Yolanda. Great to be here with all of you today. Good afternoon, good morning, if you're in the West Coast. My name is Michael Santos. I'm the Associate Director of Results, U.S. Poverty Group based in Washington, D.C. My focus is actually on housing. And I also am the current chair of the American Bar Association's Commission on Homelessness and Poverty. So I work with the legal community in addressing legal problems of people who have experienced or currently experiencing homelessness and poverty. And prior to joining Results, I was actually doing eviction defense work in San Francisco Bay Area, where I represented clients in the San Francisco Housing Court. And at the time, I represented some tenants who were getting evicted, but also experiencing food insecurity. I've actually had a couple of clients where they were getting evicted because they were unable to pay the rent because they wanted to put food on their family's table. So really, really happy to be here to talk about this intersection on food, housing, and nutrition. Next slide, please. So a bit about our organization. I know Yolanda and I had talked about our organization called Results. For those of you who have vision impairment, this slide shows a woman with long hair and purple long sleeve shirt holding a sign that says "Voices that Change the World." And that's precisely what Results does. Results is a movement of passionate, committed, everyday people. And together we use our grassroots constituents, use our voices to influence political decisions that will bring an end to poverty. Next slide, please. So our primary focus is on Congress. So why Congress? Congress makes decisions about pretty much everything that touches our lives, right? From taxes to investments, financial services, to voting, to other important programs that could improve outcomes, health outcomes for millions of people across the country. What you're looking at here is a slide, a snapshot of Congress in session. Yet many people don't know who represents them in Congress. In fact, like when you talk to people on the ground, most people don't know who their representatives are or who their senators are, or they don't actually engage with these members, these lawmakers. And many of them will never contact their member of Congress, or for that matter, hold them accountable to the decisions being made on the Hill. So our focus really is on primarily working with lawmakers in Congress on the Hill in Washington, D.C. So this next slide shows you why we do this. Why do we actually work primarily with Congress? That's because when there was the survey conducted by Congressional Management Foundation showing what influences these lawmakers on the Hill, and what they found is that pretty much relationship building is key to influencing the decisions being made by your lawmakers. And if you look at the very, very top of this page, it's a chart showing what behaviors or what actions actually provide a lot of positive influence to lawmakers to help them, to guide them in their decision making. And what this survey had found is that in-person visits from constituents, like hearing directly from constituents in the districts and in the states, make a big positive difference in how lawmakers behave on the Hill and how they make decisions. So this is why Results' focus is on working primarily with lawmakers on the Hill to influence and to create the political will that will end and prevent poverty for everyone. So I'm going to turn it over to Yolanda to talk about some of the programs that we have at Results.
So at Results, we have a program called Experts on Poverty. It is a diverse team of individuals from across the country who have lived experience of poverty. They advocate for effective government and policies. to support low-income individuals, and they speak directly to members of Congress. They present at conferences, community events, and they also appear in local and national media. The Results Organizing and Advocacy Fellowship is, again, another diverse team from across the country. Fellows with firsthand experience of poverty do participate in the fellowship. It is comprised of adults ages 20 to 35, and again, they speak directly to lawmakers, and some of them do present at conferences, community events, and they also appear in local and national media. So Americans continue to face a growing crisis. There are a series of issues that have created a perfect storm in many communities. 20.3 million households were severely rent burdened in 2021. That's an increase of 2.7 million from 2019. In 2012, the United Nations Conference on Sustainable Development created global goals that related to political, economic, and environmental challenges that we all face. In the United States for years, we have had conversations about how your child's zip code can affect their educational prospects because of lack of funding and lack of resources. But we do not discuss how your zip code could affect your health and access to food, or how the current housing costs can leave some families food insecure. So we're going to start with just a few definitions. So there are an estimated 6,500 food deserts in the United States of America. Food deserts used to be described as urban centers with lack of access to healthy food, but a food desert as of 2022 is now defined as a tract with at least 500 people, or 33% of the population, living more than 1 mile urban and 10 miles rural from the nearest supermarket, supercenter, or large grocery store. And that was changed by the United States Department of Agriculture. Housing and Urban Development defines rent burden as individuals who pay more than 30% of their income for rent. Severe rent burden is defined as paying more than 50% of income for rent. This ability to access other basic needs is prevented by being rent burden or severely rent burden. So that means that folks cannot access food, healthcare, or medications. Also, 57% of children live in rent-occupied homes, and 14.1 million children are in households that are affected by rent burden. With 1 in 4 families getting the Housing Choice Voucher, this leaves many Americans waiting on waiting lists, hoping that they will eventually get a voucher. Housing affects our overall well-being. And the Biden-Harris administration held a White House conference on hunger, health, and nutrition in September of 2022. The administration is focused on diet-related diseases, with housing being a part of the conversation in terms of access to physical activity. But without looking at the correlation between lack of access and resources and the causation of diet-related disease, the administration is missing a key part of the conversation. Our country is now facing a crisis with affordable housing, food deserts, and medical deserts as well. If we are going to communicate about the access to healthy nutrition, we must look at what effects where you live can have on your health. One of the recommendations in the national strategy that was presented was that most local communities have small stores or bodegas, and the recommendation in the national strategy is that if they do not offer an array of fresh fruits and vegetables, they would lose their ability to accept SNAP. This would punish some communities who rely on these stores to get what staples they can purchase in their communities.
Thanks, Yolanda. So before we actually get moving, I think a couple of housekeeping things as well. I know there is a chat available for attendees. I encourage you to provide comments there, or if you have any questions, time permitting, because we only have 45 minutes to be with you today. We'll try to answer them as we go along. If not, you'll have our contact information after today's session. So this next slide, really talks about how did we get here, right? How did we get to a place where your zip code dictates how much access you have to resources like good schools, good healthcare, good food, and even stable housing? So what you're looking at in the slide are a couple of things. There are two maps that you're looking at. The one on the left is a map of Chicago, like zooming out, that includes the neighboring suburbs. And then on the right-hand side is a map of Milwaukee, downtown Milwaukee. And in both sets of maps, you could see some color coding. Some are bluish, some are yellow, some are red, some are green. All of this to say that this is how we've organized housing in the past. And this is what's known as redlining. So redlining is a discriminatory practice in which services are withheld from residents in neighborhoods classified or identified as at risk or high risk or even hazardous to investment, right? These are like bad neighborhoods to invest in, and investors won't get their return on investment. And it was not, I repeat, it was not a coincidence that these neighborhoods have significant numbers of racial and ethnic minorities and low-income residents. So how does this connect to access to services like food, healthcare, and schools? Well, redlining is a discriminatory pattern of active disinvestment and obstruction that prevented minorities from home ownership. And home ownership is a cornerstone of the American dream. And this was particularly acute among African Americans, Black people, and other people of color, right? Banks, for example, blatantly refused to provide mortgages or like home loans to African Americans and other minorities, and in some cases even offered worse rates, right, to potential homeowners who live in these neighborhoods. So the key takeaway here is that redlining is a form of institutionalized racism at its finest. It is intentionally designed to put minority communities at a disadvantage, and the result was systemic disinvestments in communities of color, resulting in economic decline and lack of basic services, whether that's, again, financial, healthcare, employment, education, and even nutrition. There's also, just to talk about this briefly, there's also this term called supermarket redlining that actually occurs to this day. And that this happens when big chain supermarkets and stores express disinterest in building their store locations in inner cities or low-income neighborhoods, and usually pull their existing stores out of creating disproportionate access to nutritious food, right? Because these groceries, these supermarkets act as a conduit for people to actually access, have basic access to healthy, nutritious meals and foods. And so by participating in supermarket redlining, you're creating this disproportionality in terms of who can access nutritious food in which neighborhood, right? And this begins sort of the connection between nutrition and housing and how all of this is tied to one's zip code. Next slide, please. So fast forward, what exactly does redlining look now, right? So how is this manifested in today's communities? I think that's a big question that most people try to answer. And hopefully many of you are familiar with this happening in your own communities because it's very widespread, right? And what you're looking at in the slide right now is actually a perfect example. Like earlier, I used Chicago and Milwaukee as examples of redlining, where you see patches of neighborhoods marked in red, right? That's called redlining. Now, this is a black and white map of our nation's capital, Washington, D.C. You're looking at a diamond-shaped map that is the District of Columbia. And this shows, even though it's in black and white, the darker the shade, the better the neighborhood is, right? And the lighter the shade, the more at risk or high risk or hazardous the neighborhood is. And what you can see, for those of you who actually have been to Washington, D.C., who have lived in D.C. or passed in D.C., the District of Columbia is divided into 4 quadrants, right? The upper northwest, the northeast, southwest, and southeast. So there are 4 quadrants. And as you can see from this map, a lot of the neighborhoods in the northwest area were deemed excellent places to invest, whereas places like in the southeast, which are actually in this map shows lighter shade, meaning they're more at risk, more hazardous to invest in. And again, these areas where they're marked as high risk or hazardous for investments are predominantly Black neighborhoods. So to this day, you can actually see how all of this plays out, right? And what I had done is basically pull screenshots from the different neighborhoods in the district from each quadrant. Now, as a caveat, right, you may be able to find higher priced houses in different parts of the DC, not just in like the Northwest or the Southeast. That's particularly true in any neighborhood as well. But I thought that this demonstrates a great point of how redlining manifests in today's communities. So if you look at the Northwest, right, on the top left of this slide, I pulled a home that was recently sold for $1.63 million. And just as an FYI, all these homes that I pulled were about the same size, right? So we're really looking at the exact price that these properties were sold recently in the past, this month really. And you're looking at this Northwest neighborhood that was primarily, mostly white, fewer Blacks, and it has a very high value of 1.63 million. You look at the Southwest, and it's about half of that. If you look at the Northeast and the Southeast being like predominantly Black, mostly racial minorities living in that community, the value of a similarly sized house is $220,000. So think about that, for example, right? Like how these houses have been undervalued, especially if you're living in low-income neighborhoods, right? So the idea here, the key takeaway is a comparison of the property values from different quadrants of Washington, D.C. And these are all tied to higher rents, potential for displacement, and really connection to the number of grocery stores and hospitals in the area. Because as neighborhoods were redlined, developers, builders continually disinvested in these neighborhoods, leaving a lot of the properties in those neighborhoods undervalued. So again, redlining resulted in undervaluing of properties in these previously redlined areas. And that's what we see here, right? Just taking a snapshot. And not a coincidence that there are fewer services here in the redline neighborhoods and are at greater risk of having food deserts. But people move, right? And we can't really look at these neighborhoods in a vacuum. And when people move to cheaper neighborhoods to get better deals, which is the norm, that's when residents of those older neighborhoods, right, get priced out and get pushed out, resulting in gentrification. Next slide, please. So this right here is a visual from the National Low Income Housing Coalition showing how the hourly wages that a full-time worker must earn in order to afford a 2-bedroom rental apartment in that state, right? And this covers all 50 states, including the District of Columbia and Puerto Rico. And you can just see how high the wages are. And if you compare that to the federal minimum wage, many of these wages are just out of reach for a huge segment of our society. And the key takeaway here is that housing remains unaffordable in pretty much every corner of the country. Next slide, please. So I want to talk briefly about this relationship between housing and nutrition and health that we've been talking about earlier. Now, multiple studies show that housing, health, food security, they all lead to positive outcomes for young people, for families, for individuals, for households. So I'm not actually going to cover, data because many of you can probably research that on your own or even Google it. There's a lot of studies already demonstrating that, right? But when we talk to our grassroots, our constituents, particularly people with lived experience, what they talk about is that cash is king or queen, right? There's no if there's no strings attached to cash assistance, that's even better than programs where you have to apply and meet certain eligibility requirements. So when we look at policies and programs that we're going to talk about today, we'll look at what the closest approximation is to this type of direct cash assistance, right? Whether that's through guaranteed income pilots, or we're also looking at it through the tax code, because the tax code is a vehicle that has been used in the past to perpetuate inequality. And we see that as the next frontier to really achieve economic justice for minorities who have been historically redlined, and communities that have been traditionally disinvested by the government. So this slide right here showing a snapshot from the Magnolia Mothers Trust. It's a program of a community-based organization based in Jackson, Mississippi, where they gave Black mothers living in federally subsidized housing in Jackson, Mississippi, $1,000. They gave families $1,000 per month for 12 months. And now I think it's in the fourth cohort of the program that has led to dramatic increases in the percentage of mothers who are able to put food on the table, to pay their bills, and even have money saved up for future emergencies. And participants actually reported really great outcomes, better outcomes, including a sense of joy and just being able to care for and spend time with their kids. Also, the program gave participants a great sense of dignity. They had more self-confidence, and a feeling of agency in their lives. And I believe one participant even reported improvements in their mood, in their mental health. That was really, really noticeable even by medical professionals. So wanted to highlight how all of this actually bleeds in together: housing, nutrition, and access to health. And what we see is some of these interventions that really target and focus on guaranteed income, cash assistance, does a great job of demonstrating how all of these are interconnected and interrelated. Next slide, please. And for those of you who are interested in the Magnolia Mothers Trust, the source is included in the slide, so I encourage you to all check it out. There are several guaranteed income pilots across the country that are ongoing, and I encourage you to look into those and the outcomes and outputs that they're reporting. So another iteration of the guaranteed income / cash assistance actually exists in the tax code. And this existed in the middle of the pandemic, right? When the child tax credit was expanded and eligibility was lowered. So even those with extremely low incomes or no income at all got the credit, right? And it was, I think it was $3,000 or $3,500, depending on the age of your child. And what you're looking at in the slide right now in front of you is a chart of how families who received the advanced child tax credit in the middle of the pandemic, that was in 2021, how they spent their tax credits. And again, tax credits, by how they function, is pretty much a close approximation of what cash assistance could look like, right? In terms of legislation, in terms of program within the tax code. So we chose this as a solution, as an intervention to highlight for today. And this chart really shows, how households with children spent their CTC. And not surprising there, a lot of the families and households who were eligible and received the CTC advanced credit spent their money on food. So you're looking at different bars in this chart, the highest of which is food, right? Many families who received the CTC spent their money on food, but they also spent it on other things, including rent and utilities, and even clothing, highlighting, again, the intersectionality of the needs between housing, nutrition, and healthcare. to say that these are some of the solutions that I want to highlight that talk about the intersection between housing, nutrition, and health. And we'll talk about this more in a little bit. But I want to turn to Yolanda to talk about more specifically on the health side of things.
So this is a map of the United States. You can find this on GoodRx. The source is also cited at the bottom of the screen, but it shows healthcare deserts, county by county. And there are some counties that were not able to get information for. But the darker the color, the number of healthcare deserts they have. So if the color is black, they have 6 healthcare deserts or more. So in June of this year, there were 293 hospitals at risk of closures. 17 of the states on the list did not take the Medicaid expansion, including my state, South Carolina. We have food deserts, and now we have medical deserts. Communities over 5 miles from the nearest acute care facility, combined with the squeeze that families feel being rent or housing burdened, typically families cut their meal spending to ensure that they have a roof over their heads, and many families cut their medication spending. Before I worked at Results, I worked as an occupational therapy assistant in a skilled nursing facility. And I can tell you the number of patients that I cared for who lacked access to basic health care was higher than your average. And these folks were people that worked all of their lives, that they raised their children. They did what they thought they were supposed to do. And due to lack of health care, their health started to decline, and they weren't able to prevent falls or prevent illnesses that most people would be able to prevent. So for me, the United States has been woefully underprepared for the current housing, medical, and nutrition crisis, especially when it comes to our baby boomers. Baby boomers statistically have always been the largest generation, but I don't think that our government prepared for housing needs or healthcare needs or food needs for our elderly patients. And many of these folks, again, worked all of their lives. They retire. Once middle class, they cannot afford to buy food for themselves. They have to search and go on lists for affordable apartments in aging complexes. And these are also folks that apply for SNAP benefits, and they may get $79 a month to feed themselves. So they have to make a lot of hard choices. The same goes for young families that are experiencing healthcare deserts. There was a documentary that I watched about West Virginia, a county in West Virginia, where there was no access to dental care but once a year. And a group would come in, do all the dental work in one day, and you would have to be in line early to get dental. That is a part of healthcare, because of course we know that if you don't take care of your teeth, that can affect your cardiovascular system. So there are a lot of things that go into healthcare deserts that we don't think about, but given that the Biden-Harris administration is focusing on diet-related diseases, if you are living in a part of town that you don't have access to regular healthcare, and then you don't have access to a healthcare system or to dentists or pharmacies, that also helps increase your chances of having a diet-related disease.
Yolanda, can I say something real quick?
Yes,
Just on the
absolutely.
earlier side. I mean, I think you beautifully laid this out, but I think for those of you who are like doing advocacy in this space, I am a housing advocate, and I'm always pushing for like greater collaboration and coordination with other coalition partners, especially coalition partners who work in the field of nutrition and also healthcare. So I actually grew up in a household of nurses. My sister is a nurse, my stepmom is a nurse. I have aunts who are nurses here in the United States. And one of the interesting conversations that we had recently when I was visiting them in Texas was that they were telling me how a lot of their patients were postponing elective surgeries because they were fearing that the cost of healthcare is so exorbitant that they're going to, by choosing to do the elective surgery, that they're actually foregoing their homes. So that is a scary thought. But for those of you who are looking to do more advocacy in this field and exploring the intersection between housing, nutrition, and healthcare, I think it might be a good idea to also like reach out to like healthcare professionals, because they could tell you right away what they're seeing on the ground, how patients are reacting, and like considerations that they take into account when undergoing some of these like medical procedures or even dealing with their own healthcare issues. So I just wanted to add that, but thank you, Yolanda. Go ahead.
And especially dealing with medications. I'm a diabetic, and I did not realize how much medical care costs. Even coming from a healthcare industry and knowing, the cost of just basic care in a skilled nursing facility or in pediatrics. And I am 43 years old, and my sensor for regulating for monitoring my diabetes by itself costs $1,100 for 3. One is just $500. If I did not have health care, I would not be able to afford it. The medication that I take to control my blood sugar, which for me, it is a genetic disease because it runs in my family along with a bunch of other things. It costs over $3,000 for one dose. So it's things like that that I don't think we factor into the conversation about how nutrition is affected by everyday expenses, including housing, including healthcare, and just looking at the cost of, my son just recently had surgery and he had a rod placed in his leg. That was $13,000 just for the rod and the 3 nails to hold it in place. So healthcare is exorbitant. And if you're in one of those positions where you have to decide on, do I get an elective surgery or do I keep money to feed my family? The majority of people would go for feeding their families, to be honest. And I would be one of those people if it were me. So let's talk about some solutions. In the 2017 Tax Cuts and Jobs Act, opportunity zones were created. This was written by my senator, Tim Scott from South Carolina. And the design was to provide an incentive to revitalize economically distressed communities by spurring long-term private investments. Opportunity zones could be a place-based solution for food deserts in many communities. However, instead of this happening, people are being priced out of their locations. Some places, such as older apartment complexes, are being sold to investors, and they are building luxury apartments, and they are evicting the folks that have lived there sometimes for decades. Opportunity zones, they're not a standalone solution, but with more than $12 billion raised by qualified opportunity zone funds as of 2021, the federal government is incentivizing private investments in housing, supermarkets, and in other stores. And there are areas that have seen apartment complexes go away, luxury apartment complexes come into play, and high-end stores and Trader Joe's or Whole Foods, stores that they cannot afford to shop at. Also showing a cross-reference of opportunity zones and food deserts, almost 30% of food deserts are in opportunity zones. So these are opportunities for investors to really help impact food deserts. And you can see that 97.85% of opportunity zones are in low income communities. So let that sink in just for a little bit. They are in low income communities. And as you can see on the East Coast, it's mostly peppered in the South. My state of South Carolina, the I-95 corridor is an opportunity zone. And that is where predominantly African-American people live. And it's also the place that has, I mean, if you go and Google corridor of shame, that is what it's called, that schools are 100 years old and have never been updated because property taxes pay for schools, right? And in South Carolina, they switched it from property taxes to sales taxes. And the number one thing that consumers buy is food. And then a couple of years later, our state decided there would be no sales tax on food. So now sales tax has really been cut almost completely in those areas. Michael, do you want to talk about the renter's tax credit?
Sure. So the second bullet point that we're looking at is just some solutions around tax credits and guaranteed income. So we had talked about some of this already earlier, looking at how the tax code could serve as a proxy for guaranteed income programs across the country. And one prime example of that is the child tax credit. But we're also looking at other programs within the tax code, like the earned income tax credit, right? Expanding that for many low income workers who can actually use the money that they get as a form of tax credit to pay for not just housing, but for food, for healthcare, for other issues, for other expenses that they may have on a month-to-month basis. The problem we have right now is that many of these tax credits, when you file your tax returns, you only receive them once a year, right? When you file your tax returns, either on the federal and or the state level, and that's when you get if you get a refund, that's really the opportunity the only opportunity you have to receive these tax credits. One solution that we're pushing for is actually making the tax credits available to as many low-income, possibly no-income households across the country. And we're looking beyond what just the child tax credit and the earned income tax credits have done in the past. We're also looking at creative, innovative solutions, such as the renter tax credit, right? The best way to think about a renter tax credit, for those of you who are unfamiliar, because we don't actually have a federal renter tax credit yet, it doesn't exist in the tax code, but many states, almost nearly half of the states, have some type of renter tax credit that is designed to supplement people's incomes so that they can get help in paying for their rent or for their housing, right? This is the existence of these policies and programs on the state level is a tacit but surefire way of acknowledging that people have limited incomes, right? Some states actually have targeted renter tax credits for seniors or for people who are over the age of 65, right? Retired people whose limited income was based solely on like Social Security or SSDI. Some renter tax credits, for example, are geared towards people with disabilities. Again, like targeting and acknowledging that these populations, these communities may have limited access to steady and stable income. And so these are designed to supplement those limited forms of income. But the idea here is that renter tax credit is an expansion of the idea of a child tax credit, because the child tax credit, for what it's worth, and it's done a great job of lifting children, making sure that children are, lifted out of poverty. But these are, in order to be eligible for the CTC, you need to have children, right? But many households across the country also are rent burdened. They're paying more than 30% or 50% of their income towards rent, but they do not have kids. Thinking about young people, college-age students who are experiencing rent burden across the country because it is just so expensive to live in like cities or even rural communities, depending on where you are. the idea here is, again, to use the tax credit as a solution to achieve economic justice and to provide a stable housing so that people could afford, to stay in their own homes or to find a home that's actually cheap and affordable to them. Yolanda, turning it back to you about the other solutions.
Yes. So another solution would be tackling local ordinances that prevent multifamily affordable housing from being built or in place in certain neighborhoods. It should be evaluated because this is the biggest issue with our housing and the lack of supply of affordable housing. It's the not in my backyard thought process. This would significantly lower housing costs. And then also, as we know, wages have not kept up with rent increases. Increasing wages to put more money in the pockets of Americans who are rent burdened would help solve the two basic needs of housing and access to food. Michael, back to you.
Sure, thank you. So I know we only have a few minutes left, so really wanted to hone in on some of the key takeaways. I know we covered a lot in today's session, and really glad that you were able to join us this afternoon to talk about this very, very important topic of the intersection between housing, nutrition, and healthcare. But there are a few key takeaways, right? The first one is really talk to your lawmakers and policymakers and other advocates, whether you're looking at it on the local level, on the state level, or on the federal level. Your stories matter, right? And earlier today, we had talked about what results is, who we are, and who we work with. And Yolanda had beautifully laid out, we have a cohort of fellows, young people, and also our experts on poverty. These are grassroots constituents of Congress who have lived experience of poverty, of housing instability, of homelessness, of food insecurity, and their stories really matter. And really, they are the experts. So for those of you who are on the ground, who are seeing these stories, hopefully we've inspired you to talk, to think through some of the issues that you can talk about to lawmakers, because they really listen. They listen, right? And the thing is, like, you need to know and understand how Congress works, how policymaking works. There's just so many proposals out there, and our job is to really help them focus on the issues that matter the most. And the way that we can do that is actually sharing stories and talking directly to lawmakers, policymakers, and advocates, and forming these long-term relationships, not just like a transactional, talk to them once, right? Because talking to them once, that will be overtaken by other issues, more pressing issues, as we see today, right? The other piece that I wanted to just highlight is integrating and centering people and communities with lived experience in policymaking and decision-making, just piggybacking from what I talked earlier, right? The importance of making sure that the stories, the advocacy is really grounded on the people who are directly impacted by these policies. It's really helpful to and useful to integrate people with lived experience and from research, from development, from planning, all the way to implementation and execution of these policies. Because without them, the whole thing falls apart. And then, do you want me to cover, Yolanda, the third bullet point? Okay. Another key takeaway, as we had talked about, is like housing discrimination really intersects and is interrelated with the current problems we see. Hopefully, the charts, the slides that we had presented earlier were helpful to see how housing discrimination, how redlining is tied to lack of access to nutritious food, generational wealth, right, housing affordability, and access to adequate healthcare. And Yolanda, you want to cover the last two?
Yes. So, and also heed important lessons from tax credits, direct cash assistance programs. We have members of Congress that say that guaranteed assistance would not work, but they proved that it would work with the child tax credit. So always keep that in mind, and keep the pressure on lawmakers to do what is needed. We see a lot of things in the media, but we are the people that hired them, and we need to let them know what we need them to do.
And before we end, Yolanda, I think one thing that is like the elephant in the room, right? Be a great advocate. And I think your advocacy, your voice is really important, especially heading into 2024. It is an election year. There will be candidates running for office. There will be lawmakers who are, trying to preserve their their status in Congress, and so, or trying to get reelected. So it's really important to hear directly from you as advocates pushing for these policies and solutions to address, food instability, food insecurity, housing insecurity, and homelessness.
Thank you all for joining us today. And remember, be the best advocate that you can be and speak up, especially during this time. And especially, again, because next year is the presidential election. And we want to make sure that our voices are heard not only at the ballot box, but also in congressional offices. So thank you all for joining us. And hopefully we provided you some information to really think about.
Thank you.
Have a great day. Enjoy the rest of the session.
Thank you, Michael. Thank you, Yolanda. Up next in our main session is using research to create hunger-free communities. Click that join button to enter, and that concludes our time together. Have a great day.
Thank you.